Australian Rotary Health is one of the largest independent funders of mental health research in Australia. Along with mental health, we also provide funding into a broad range of general health areas, provide scholarships for rural nursing and medical students, as well as Indigenous health students. Governed by a board of directors comprised of Rotarians, Australian Rotary Health is a project of Rotary districts of Australia and is supported by Rotary clubs across the country. Our supporters raise funds for health research in several ways, including cycling and walking events, morning teas, fundraising dinners, trivia nights, and more. Our national fundraising campaign, Lift the Lid on Mental Illness, supports mental health awareness in the community, as well as research into improving the mental health of 0 to 12-year-olds. We believe that research into the prevention and early intervention of mental illness and suicide is critical, as statistics show that half of all mental health conditions we experience at some point in our lives will have started by age 14. Suicide remains the leading cause of death in children aged between 5 and 17 years. As part of our Lift the Lid campaign, we encourage Rotarians, workplaces, schools, and the general public to celebrate Hat Day with us on October 10 on World Mental Health Day, or any time during October for Mental Health Month. You can get involved by hosting an event, wearing a hat, or simply making a donation. Our Lift the Lid Walk for Mental Health is another Lift the Lid initiative that began in Mooloolaba in Queensland and has since expanded to other locations across Australia. The walk and talk format gives the community an opportunity to come together to start the conversation about mental health and raise vital funds for research. The money raised from these events are allocated to mental health research grants, postdoctoral fellowships, and PhD scholarships through a competitive application process overseen by a group of experts in the mental health research field who make up our research committee. As a result, we have funded successful mental health projects focusing on improving sleep problems and anxiety in children, teaching teenagers how to help a friend experiencing a mental health problem, and learning that what we eat really does impact our mood. Since 1981, Australian Rotary Health has received more than $51 million to go towards this health research. From the early days, funding research into sudden infant death syndrome, which reduced the number of infant deaths by 80% worldwide, to funding the early development and trial of the mental health first aid program, which has now been adopted in more than 25 countries across the world. It goes to show that research can have a significant impact on improving our health and well-being, but we still have much more to learn and uncover. Our broad vision is to improve the health and well-being of all Australians, but we are only getting started. To learn more about Australian Rotary Health, visit australianrotaryhealth.org.au. To support Lift the Lid on mental illness events such as Hat Day or the Lift the Lid Walk for Mental Health, head to liftthelidonmentalillness.com.au. And to hear directly from our funded researchers who are making a difference to mental health, listen to our podcast called The Research Behind Lift the Lid. You can help by donating today. Thank you for your support.